Coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. I'll show you how to live life in style in one of the country's most elegant cities, nestled right along the beautiful Atlantic beaches between Palm Beach and Miami. So sit back, relax, and let me show you how to indulge yourself Boca style. Oh, hello, welcome to the Becky and Boca show. I have a great guest tonight, Dr. Janet Allenby, cosmetic dermatologist, and she's very well known in this area. And we're going to talk all about things we can do to our faces and I guess our bodies too, huh?
Oh, you know what? Body is like the new face.
Yeah?
Yeah, it definitely is it's kind of taking over. I think the biggest trend is actually non-surgical body stuff now.
Yeah, you're doing a lot of that stuff.
You know what? It's really, I think it's not obviously just my office. It's across the world. It's global.
Yeah.
So body is like definitely the next frontier.
The new thing. Mm-hmm. But before we go any further, we have to talk about Teresa Giudice.
Giudice, yes.
From Real Housewives of New Jersey.
Oh my gosh.
She is going to be at your grand opening of your new office, or your newly renovated office.
Right.
And it is on November 9th. Mm-hmm. And what are the hours of that?
We're going to be starting about 5 o'clock. It's going to be about 5 to 9. Okay, so November 9th, we're going to have, it's basically a reopening of a new location.
You're moving into a new space in the same building.
Exactly. Same floor, everything else the same. Same building. It's a little bit bigger, but we're totally renovating it. And we're just, we want to make it really patient-friendly and really try to make it the best for the patient. And that's kind of why I did it. I could have stayed in the spot I was at, but it was like, you know what? I need to do something to make it nice for the patients. And it is really going to be...
Oh, I'm sure it's going to be beautiful.
It's going to be
beautiful.
It's going to be fantastic.
I was there yesterday, but I didn't go in there and look.
Oh, it's exciting. I know all the cabinetry's going in right now. It's going to be really nice for everybody.
So you're going to have Teresa there, and she's going to be meeting people and doing photos and signing photos.
Yeah.
And I hear she's very entertaining. And
you know what? We might bring a table and see if she'll flip it.
Okay. That's right. Put a cake on it.
Right, exactly. No, actually, we're having a great time talking about her. It's really interesting. All the patients are so excited to see her. They are just
she's in all the tabloids, and
she's a firecracker.
Yeah,
exactly.
It's certainly going to be an interesting evening.
We definitely have a lot of things planned. We have about $10,000 worth of gifts to give away that night.
Good. What kind of gifts?
We're doing M-Sculpt, and which I can discuss more about, body treatments. One of the things that we are giving away, we're going to do a total body makeover with cool sculpting.
Oh.
So that's going to be one of the raffles that we're going to have. We really, we brought a lot of new things into the office. And I will tell you, because aging is not a fun event, and
No, it's not.
No, it's not.
But we do everything in Boca Raton that we can to prevent it.
Exactly. And as every week goes by and I find something else like falling apart on myself, I'm researching out how can I make this better? For me, because I see.
I know that's the beauty of going to Dr. Allenby is she tries all this stuff on herself.
Well, you know what? I'm seeing what's breaking on this body, and it's like, you know what? I have to find out how to take care of this, and it really makes a big difference. I will say I've bought $500,000 worth of just devices.
I saw all the equipment there in your office yesterday.
Well, as you saw, it's too much for the office that I'm in, and
you need the new space.
Right, I have machines lined up and down the hallway, and we're kind of stumbling over them at the moment. Which at the moment I have 4 cool sculpting machines, which a lot of people know what cool sculpting is at this point. It's the non-surgical fat reduction by chilling the tissue. The fat basically is traumatized enough that it dies and it just absorbs, so you get a 20% improvement for each application.
And that works pretty well, doesn't it?
It works fantastic. And I think, because it's done so well in the market, everybody recognizes it, and then Allergan is supporting it because they own it now. So it's really become much more mainstream. The newest technology that just came out is called M-Sculpt, which is I
saw that machine in the office too.
It's electromagnetic energy that is directed to a muscle mass, like say your abdomen or your glutes or your thighs, like your quads or your hammies, whatever. And what it does is it contracts it on and off for about half an hour, but it's like 20,000 sit-ups or 20,000 crunches, 20,000
It's like passive exercise?
Exactly. And it's not a TENS unit. It's not the old TENS unit where, like what they had on TV where you just electromagnetic one or the ones that they have that's just hitting the muscle. This is actually the entire muscle group is contracting. And you do see the improvements. It's interesting because you usually have to
tighten up your abdomen.
Yeah, you can get like rock abs. Yeah, it's fantastic.
Wow.
Exactly. So what I have seen with this so far, I was like one of the first in South Florida to get it because, of course, it's like all about my body. But what happens is that it's a couple things that's interesting about it. One is that you see the results probably in about 2 or 3 weeks after your treatment. So for the first 4 treatments is how many you do, 2 or 3 days apart. And about 2 or 3 weeks later, all of a sudden you start seeing like,
because that's how
chiseled.
long it takes for the muscle to start.
Exactly, to grow.
Yeah.
Because it's just like exercising. You're not going to see abs the first day that you do your crunches when you're going to your regular gym. So when you're seeing the changes, it's a little bit further out, which is, I think that some people are like expecting to see it immediately, which it's not. It's not like our fillers that you do see immediately. Yeah. But the great thing is it also tightens up the tissue, the skin, everything tightens up. So those mommy bellies, which are a big problem, tightens right up. The other thing that I really liked is that it makes your core strength much better.
Oh, really?
So
I guess it would, yeah.
Yeah, so people who have, when I do it, I feel it not only in my abs, I feel it in my back, kind of like my psoas muscles, everything's contracting. So your core strength is better. So people who have injuries, like say you're out because you have a knee problem, you can do this machine and it actually keeps your core good while you're out, so you can actually kind of help your rehab a little bit. It really is interesting. I did like one treatment when I was at a convention, when I was like looking at the machine, and then I like went swimming a couple days later, and I'm like, I couldn't believe how well I could swim. I was like, this is the machine. So
wow.
It really does, and I have definitely felt it myself. The stomach.
Can you use it like on the arms and things?
It's not like somebody like you and I. We have too small arms. Maybe a guy could. It just depends on the muscle mass. There are some people that are trying it on the chest. I like for a guy for pecs.
A guy. Okay.
A little bit more. I'm a little more leery. I'm not that brave at this point. It is something that it's close to the heart muscle, and we don't want to get that close to. Yeah. So I'm kind of staying away from that. Exactly. I don't want to cause any harm, and there's no reason to for something as simple as this.
Right.
And I would say for us, most of the time, it's women, our abs, butt, and thighs. Those are our big areas. And definitely for the quads, it makes a big difference. Like the legs look a lot tighter. It actually has improved some cellulite. That's another thing we're working on a lot is cellulite, because that's the great thing that nobody can ever get a handle on, no matter what we do. Even our Selfina, which is a procedure that breaks the little tethering that pulls the cellulite down. It's good, but it's definitely a procedure. It's a little more invasive. I love it, but you have to have the right patient for it, and you have a little bit of downtime with that. I do have a new radio frequency machine.
You do? Which one is that?
This is called Thermi. There's like Thermi everything. Thermi Tight, Thermi VOD, Thermi Smooth. And what these do is that the radio frequency, it depends on how you're using it. Thermi Smooth, you can actually reduce the cellulite by actually treating the fat with a bigger handpiece because it has a deeper penetration into the fat. Okay. But then at the same treatment, you go with a more superficial treatment, and it's going to tighten up the tissue on the top.
Okay.
So you're going to end up having, at an older age, it's not really true cellulite. It's probably just like little pockets of fat, and it's probably loose skin. It's a better treatment for that versus like the Selfina, where they're young and they're just tethering, and it's a women's thing. Yeah,
I remember that.
Yeah, so you just pop them open.
So how often does someone have to go if they, let's say they want to do their thighs?
Okay, if you have cellulite or you have loose skin or you have rippling of your legs, and that's really common, or butt or even abdomen, usually you do it about, you do one treatment, it takes about half an hour, and you do it again in about 3 weeks, 3 or 4 weeks. And usually you start seeing the result after the second treatment. Probably about 2 weeks after your second treatment, you really start seeing it. You're like, oh, this is good. First treatment, you're like, I don't know if I'm sold on this. And then as you keep going, you see it improve. There's actually even some good topicals that we use in conjunction with.
To do what?
Yeah, cellulite and
really?
Tightening. Yeah, there's one called Glytone. It's a line that we've used for other things, but they actually have a really good cellulite product. It's a morning and night cream, and just has botanicals in it, but it really, when you're using it, everybody who uses it, they just keep buying it and buying it because it works, And that's how I always tell everything in my office. If something is being redone or resold, that's how I can really tell the masses like it or not, because they come and buy. Good. Yeah, they come and buy like 3 packs at a time. Yeah. It's like, okay, I know this one's working.
So you just put it on topically?
Yeah, you put it on. There's a morning and a nighttime cream, and you put it on. And, I think Europe and Glytone is really based out of Europe. Like most of their stuff is from France.
Okay.
And they are all about cellulite. They aren't so much about the face, but they are about the body.
Okay.
Yeah. So you definitely know they've always done things with caffeine, theophylline, things like that to try to help tighten up the tissue. But this is not. This is more of a botanical, but it seems to really be helping. Yeah, I'm definitely, I know. Again, everything's about me. I used it. I'm like, this works. So I definitely saw an improvement. But when you combine it with other stuff, you see better results. I think with the M Sculpt, the one thing that is really awesome, especially for women as we age, and you know what, guys too, we get flat rears, flat butt syndrome. I think we should name it or something. Flat butt syndrome.
So instead of getting butt implants,
you know what, butt implants are really they're a real problem if you kind of go through plastic surgeons articles. They are really frowned upon anymore because
really?
Yeah, there's a real high risk of embolisms, and when you're putting fat into butts, and it's usually not necessarily an implant, it's actually fat transfer.
Fat graft?
Yeah.
Okay.
Usually it's fat grafting more than anything. Same as when you're doing it with liposuction, you're always a little bit worried that you're going to hit a big vessel and somebody in embolism. So they're really kind of cracking down and trying to be a lot more diligent in how they're done. And they're monitoring a lot more because there's a big problem with it out there. And it's more in the plastic surgeon's realm. If you get the articles on it, it's actually a big deal in their world. We don't do that. Butt implants themselves, I don't know. There are some people that I'm sure do fantastic jobs, but I just can't imagine sitting on 2 balloons all the time.
I know, that would be so weird.
I know. I just can't wrap my head around that. I don't care how bad things look. It's just like, I don't think I can do that one. So, so there's a lot of different little things going on with that, but getting a lifted butt, and it's we can do.
So you can do it with that machine.
You can do it with that machine, but you can also put a little Sculptra to kind of help it out a little bit, and that's a real simple injection, and it's a very little instrument. I use cannulas, so it's a teeny little cannula you use to inject with, so you're not risking having a problem with an embolism, and that's always the big risk with that one. So
oh wow,
yeah.
Okay.
So it's been amazing, and I think that with M Sculpt, it's like one of the things that like all the celebrities are doing. People just haven't heard of it yet because it's just not been out. I mean, it's been available for probably 4 months.
Okay.
So it's not
brand new technology.
Brand new. Yeah, I actually have one machine, and I already have another machine coming.
Oh, you ordered another one?
Yeah, it is.
Must be working then.
It works, and it works well. You know, and it's just busy all the time. But it's just like a little boop, boop, boop for half an hour to an area. And
is it unpleasant or?
No, when you start with it, it's like, oh, okay. It's kind of like whoop, whoop. And then you just start going higher up on the numbers. And if you just give it a few minutes that regulate, it just, you keep raising it up, and you try to get as high as you can. But no matter what, if there's contraction happening, things are going to change. Mm-hmm. So that's pretty awesome.
I like that idea of building muscle without exercise.
I know, it's like toning without doing anything. And God,
my whole body in one of those.
Who likes doing abs? Like who likes doing crunches? I know. Those are like, who doesn't just like, I hate doing these. I hate doing them while you're in them.
So you just lay there and
passively let it happen.
Wow.
I know. So other thermy things that are really cool that are going on. We actually started doing Thermiva, which is a women's intimate health issue.
Oh, is that vaginal?
Yes.
Okay.
So it's vaginal, internal, external, and it really is amazing because it's such a delicate subject. And, I think a lot of people are very shy about it. And like just talking with patients, and I'm very close to my patients because I'm in their faces. We talk a lot. We have a lot of personal discussions. And even starting to talk about this is still hard for a lot of women.
Yeah.
It's very embarrassing for women to talk about painful sex or stress incontinence or I sneeze and I pee or I run and I pee.
But that's very common.
And even if you don't have kids, it's very common. It's just, again, when you get to a point where you're starting to lose your hormones, your estrogen, everything falls apart. And, it is an exponential downhill slide that is really, it's hard on a ego,
Sure.
Yeah. So, when you can help somebody kind of regain their sex life again or feel good about having sex again, it helps their partner, it helps them. It's very interesting because the women that we've done, I think the husbands have been so pleased.
That's what I've heard about those machines.
Yeah, I will tell you, it makes things a lot better in a lot of respects.
And then is it permanent once you have the treatment done?
You normally do, again, 4 treatments. Everything's like 4 treatments.
Yeah.
So you do 4 treatments, and then you probably want to do one in about 9 months. You don't want to go down to baseline because then you got to kind of start over. Usually it's 3 to 4 treatments for most people. It just depends on how bad the situation is. Some people are not bad and they just 3 treatments would be fine. Some people probably need 6 treatments and people don't even know where they're at on the scale because there's no discussion out there. And that's the big problem is that nobody wants to talk about it.
Yeah.
Guys are probably more willing to talk about stuff like that, but women, it's kind of embarrassing. They're a little bit ashamed of it. They don't know how to talk about it. And it's a big problem. And, having less sex life with your partner as you go on with age is very detrimental.
It's a problem, yeah.
It is. And, I don't know what the statistics are on that because I'm sure they're out there. But I think that, a lot of these women are seeing a much healthier sex life and
So
intimacy.
how does the treatment work? What do they have to do?
The radio frequency, basically it's a 15-minute internal, 15-minute external. And what happens is it's just heating the tissue and that heat, when it's brought to a certain level, and there are better machines out now than there were before. Very important. Radio frequency, like everything, has had its aging process, meaning we started off with just machines that had no control. It's just like, oh, here it goes,
Right.
zoop, 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 you're zapping. You don't know where you're at. Temperature could be anywhere. They have come to a point where they've actually, because I just got the newest machine, I got re-educated. I've had other radio frequencies in the past, and this one is just like, as soon as you get to a certain temperature, you got to keep it for a certain amount of time. That's the key right there.
Oh, okay.
And if you don't get to that temperature, you're not going to get therapeutic results, which is like a softening of the mucosa, more lubrication. Externally, if you can help a woman have better orgasm or even have one, that is huge.
Yeah,
And
that is huge.
It makes it right. It's
So this machine does that?
it helps that. Yeah,
Oh, boy.
it does help
Wow.
that. I know. She's like, okay,
Yeah,
I'll
okay,
go
I
back
like
to
that
her
one.
office. Let me tell you, it is definitely. The other thing I didn't really realize because nobody. I'm a doctor and I don't even know half this stuff. Part of the internal part of the vaginal area kind of drops down, and so you start seeing a drop. And actually, that's kind of why it looks different as we get older. There's a drop in the middle, and it kind of effaces a little bit. It actually everything pops back in again
When you do this.
and you have little young coochie again.
Wow. Young coochie.
Yeah, exactly. Maybe that'll be the tagline. Do you want a young
Do you want a young
coochie? Who doesn't want a young
All right.
coochie?
Okay. So that's a good machine.
It is a good machine.
Yeah.
So they also have with that, we can do radio frequency on the face. But again, it goes back to the device itself is allowing us to get a certain temperature for a certain amount of
To
time.
maintain it for- okay.
And really monitor those. Like I have also ThermiTite, which is a probe that I use under the tissue. And I make it a little
Where
opening.
does that go?
It usually tightens all this. And it's fantastic. Yes, if you actually... I think we already have some before and afters up on my website because it really, I just did my mom.
And what's your website?
www.allenbydermatology.com.
Okay.
So just look us up. Just Google
Allenby
Allenby Dermatology. Yeah,
It'll come up.
It's Allenby Dermatology, but it's Allenby Cosmetic Dermatology is the other way you can reach us.
So they can go there to look at the pictures.
Yes.
Okay.
And so then the other way is, so with the ThermiTite is you basically are going through a little opening that it doesn't need a stitch afterwards, anything, but it heats up the tissue, and there's a contraction to the tissue
From the inside.
from the inside.
Okay.
So it's almost kind of like what people would think of like smart lipo, if they know what that is. And you're basically you're heating under the tissue, and it's causing a contraction, and everything just tightens.
So that'll
up.
tighten up a neck and
And
chin?
you can also get rid of some of the fat under the chin too. So if somebody has a little waddler under there, it actually helps tremendously.
Wow.
Yeah. So we've actually already seen huge results with that. We have a nurse practitioner, Sarah, who we have pretty much like made her the queen of ThermiTite, and she helped me actually do my mom. She is like fantastic, and she just it's amazing when you see it. It's like, wow, I'm actually more shocked than ever on that one. I was like, this is much better than I expected.
Okay, so people can avoid a neck lift if they if they do that.
It gets them further. I don't think anything is truly like surgical, but you don't have the risks, and you probably have like a day of downtime with it, and that's an internal procedure. They also have we also have a handpiece that's really interesting. One of the thermies, actually, you use it around the eyes, and if you suffer from dry eye, which another issue that comes with age,
a lot of people have
or
that.
a lot of times if you've had eye surgery of any variety, you end up getting the dry eye all the time. One of the hand pieces is specifically for that, and it actually helps you kind of open up your
just
meibomian
put it
gland.
around you?
You actually, it's done on the eyebrow area where your meibomian gland lives up here, and it actually helps you kind of start releasing more of the fluid into the eye. It like rejuvenates it.
Wow.
So the radio frequency kind of rejuvenates whatever you're targeting, whether you're targeting the laxity of the face, the crow's feet, the ThermiTite for the neck, the ThermiSmooth for the body. So all these things are just kind of tightening everything back up or softening them and kind of rejuvenating them. So it's pretty cool.
I like that. Yeah. So you can do the whole body, pretty much.
That's
you got
the
something
goal.
for almost everything.
Well, again, I told you, like this is this is an ongoing project all the time. It's like, what do we do for saggy necks? Okay. So ThermiTite would be one. The other is threads.
You were telling me about threading yesterday. I'm very interested in that.
We do a lot of thread lifting. It's called PDO. It's just the name of the suture. These are sutures.
And what exactly is it? I mean, I'm picturing you're putting actual threads in people's faces?
Kind of, yeah. So what it is, it's suture material. Okay, so 15 years ago, we had threads. And you might have even remembered back in the day, we would use them, and you would have to kind of lasso these things into the face, and you have to use a lot of needles, and people would turn all messed up, bloody, bruised. It was horrible. They'd break. It was a problem. The threads were actually being made in Mexico before, and they were kind of inferior, and things would break, and it was not a good situation, so we kind of abandoned it.
Okay.
In the last 3 years, threads came back because in South Korea, they were...
is this like that lift that you used to see on commercials where they...
that might be like Silhouette is maybe what you're thinking. Silhouette, you have an entry point and an exit point, which I don't like. I like this one because, and I'll tell you why. So PDO is just the name of the suture. It's the same suture that I used if I were doing a skin cancer and I were closing somebody up internally, I would use PDO.
Okay.
It is a suture that holds together the tissue inside, absorbs over time, and is replaced by collagen. So it kind of creates its own little baby scar. You leave it, and then you do your internal, your top ones, which are more superficial. And those are the ones you would take out. So PDO is a little bit better as far as you don't have to make 2 entry points. You're basically making the exact same opening that you would if you were going to use a filler. You use the cannula, you deliver it. The thread is different gauges. So if you have somebody who has like a skinny, thin face, use a small one. If you have somebody who's got a lot to lift, use a bigger one. But these threads have little teeth on them. And when you put it in, it grabs the tissue and it lifts it up. So I did... I've been doing them for about 1.5 years, and I probably do 2 or 3 patients a day. And I have figured out that you can actually, it's so cool. Whatever, it goes back to me. I'm in the mirror like, okay, if I just left at this, I just need this. It's lighting, and you sit there in the mirror and you're like, When they teach us threads, they kind of teach us to do it in a sweeping motion that you would think of with a facelift. Okay, but I realized that if you just go straight up with the threads and go straight up this way, you get neck and lower face all in one swoop.
So how deep does the thread go? Like
It's right under the
you put
fat.
it in where?
It's like in the fat. So you're
Okay.
going right in the sub-Q with it.
Okay.
And it's grabbing the
So when you
dermis
pull it,
and
the little
epidermis,
hooks are.
everything just like
So you're
pulls
just
right up.
actually lifting everything up.
You are.
Wow.
So you can actually put one straight up and down vertical this way, which I think nobody really has ever, I haven't heard anybody else doing it that way. I just found out that it was like fantastic. I'm like, oh, we're doing this. So we go straight up this way, and then I do one under the jawline. So you don't have a risk of seeing a thread, because in the beginning, one of the big problems was is that you'd see like
them
some sort of weird lumpy looking
under the skin.
Yeah.
Okay.
And that's kind of like a provider or person who's doing it problem. It's not the patient's problem.
Right.
It's how we're putting them in or how
Yeah.
they're laying under the tissue. And so, or if it got loose, it would do that. So if you're kind of doing them in hidden places, you're not seeing them, but they're lifting the neck, which is huge.
That is
and
huge.
you're lifting the face. And you're basically using 4, maybe 6 threads on the whole face, where before I was probably using 2 in the cheek, 2 in the jawline, 3 or 4 in the neck. So I was putting a lot more
So
in.
you can lift all these areas with that.
Yes.
Wow, that sounds wonderful.
The neck, unreal. Yeah,
Really?
and when the neck is lifted from the back here, it's like a facelift.
Yeah.
It probably lasts
That's what
about,
most women ask me about. What can I do about my neck?
Yeah.
That's the biggest.
it's the aging spot,
Yeah.
In probably the 40s, they're worried about lips and around the eyes. You get past 45, you get into the 50s, it's all about the jawline
Yep.
and the neck. Those are the big areas that say, I am 45, I'm 50, I'm 60, whatever. Those are the identifying marks. As we talked about in my office, one of the biggest things is it's all about shape. And when somebody's shape is down here, it's in the lower face, it's heavy.
Yeah.
They look older. They look dumpy. Those are the words that come to mind.
Yeah.
But when you're having them more V-shaped in a V up, they are looking younger. And so when you can minimize that jawline, that's the key to looking good. I mean, who cares
Yep.
about a little teeny little baby line? Nobody cares about the little lines because they don't see them. They
Right.
see the gross, meaning large picture, which is the shape of the
Yeah.
face, and that's how
Stuff hanging down here.
Yeah, when you got stuff
Yeah.
hanging down there, it's like
Okay,
meh.
okay, we have to go to break here. And right after the break, we're going to come back and talk about some more stuff. I know you have
stuff.
lots. It's like a candy store out there.
It is.
Okay, be right back. You've been listening to and watching The Becky and Boca Show. Ivy Lee's Luxe Makeup and Beauty Lounge in downtown Boca Raton does fabulous professional makeup application. Make an appointment today and see how glamorous you can look. Call 561-409-4065 to book your appointment. Ivy Lee's Luxe Makeup and Beauty Lounge is located at 233 South Federal Highway on the first floor of the Boca Grand Building in Boca Raton. The number again is 561-409-4065. And now, back to the show. Welcome to the second half of the Becky and Boca Show. I'm here with Dr. Janet Allen B., cosmetic dermatologist, and we're talking about all these interesting things
Fun things to do.
that we can do to look better.
Exactly.
We talked about the body, and then we got a little bit into the face. We were talking about the jawline before the break, so I want you to continue that because that's what most women complain to me about.
Yeah, the jawline is just like I said before. It's huge. A sagging jawline, like you said, is just it's a sign I'm old and nobody
and
wants
you feel
it.
bad when
You do.
It's I used to have a sagging jawline. That's all I saw when I looked in the mirror.
You look fantastic, and you have no sagging jawline. That's why you look like you're 12.
But it was really important to me to get rid of that. I mean, that was the number one thing.
It is
that I needed to get rid of. So I did the surgery, but you have other ways to do it.
Right. And okay, so going with that, one of the things I can do is threads. Thread lifting is fantastic. It's one tool. There are so many different tools, and each one is very specific and a different angle of getting you there. And sometimes we have to just do combinations of different things to get people there. And I think having a nice jawline is so important. again, threads will lift you, okay, and they're not adding volume to the face. So you can actually lift without giving more volume. And I know a lot of people are afraid of that over volumized look, which is absolutely legitimate.
Yes, you see a lot of those around Boca.
Exactly. This is like the Boca mantra is
Overfilled face.
yeah,
Exactly.
overfilled face, overfilled lips, crazy stuff.
Yeah.
And and we that's out. That's so out. And the people that still
Somebody
do it,
told me that the big lips are just like the oversized breast implants that used to be popular.
Exactly.
And now that's passé. Nobody gets the big breasts anymore.
No.
And the big lips
Natural.
are,
Yes.
the big lips are
I
going
hope
out
they
too.
are. I mean, it's just so awful to see them. You're just like, really?
I know. I see those and I go, what? Why?
You know what? It's really interesting with the lips when they're overdone like that and they're out of proportion. One, our brains know out of proportion very quickly without even us understanding what we know.
You know something's wrong.
You know something's wrong, but I do think the women that you see who are like 30 years old all of a sudden look like they're 50. They look so much older because
it's
it
not
changes.
an anti-aging.
No, it's actually an aging thing.
Yeah,
It's not an attractive situation. Other things to do with the jawline. One of my favorite fillers to put in the jawline is actually Radius. Radius is it's a product that we've had for probably 15 years at least.
It's a hyaluronic acid?
No, Radius is calcium hydroxyapatite. And what that is, it's almost kind of like a hard filler. It can be a little reactive. It can swell a little bit. But what it does is when you put it on the jawline, it almost recreates a jaw. And one of the things, as we age and we see that little bloop, that little dip in the jawline, it lifts it if you're making the jawline further back. If you look at people who are older, there's two things you're going to see. If somebody has not had surgery, you do see they start losing their angle of their mandible and they don't have a good jawline. So they start losing that, and that's partially why things are dropping, along with they don't have any support higher up. So
And you do that too, right?
Yeah, I am very much into supporting the entire face, because it's the support from higher up that's going to
pulls everything up.
Yeah, it's going to relate to whatever's below it and make us not have to use as much in the center. So I tend to use a lot of product, but it's really spread out. So people are like, there's a whole bunch of stuff on your table to fill me. It's like, you're not even going to see it though. It's going to just look natural.
So you put some in the hairline, right?
Yeah, I'm a huge one for the scalp. And I don't know anybody else who really does this either, but I'm a huge advocate in putting Sculptra in the scalp because it's something that is kind of liquidy when you put it in. It will grow in your collagen.
It helps you grow collagen.
It helps you grow collagen. So it actually, and it kind of pulls. So there's a little bit of fibrosis to it, meaning when it grows, it's kind of pulling you up a little bit. It pulls up your face to some degree, but it kind of widens you up here. As you get older, you start getting more, bottom heavy. That triangle starts getting heavy on the bottom, and you want to actually get it heavy on the top to kind of keep everything supported. With age, we just lose our muscle, we lose our fat, we lose our bone. And when you're recreating it in a really elegant way, people don't know what's being done. So it's like, it's all an optical illusion. It's fake, but it's not fake at the end of the day. But so you can use Sculptra in the scalp. One of my favorites to do. It's probably in the 40s, 50s. That's one of the first things I'll do with somebody.
Okay.
And
so by putting it in the scalp, you're pulling
everything
the whole
up.
face up.
It's also giving better continuity between the temple scalp. Like I don't like doing temples. I like doing scalp because especially with women, you don't want full temples. That's very masculine. You want a little concavity there, but you still want that lift there.
Right.
So you have a little bit of it almost looks continuous from the scalp into the cheek. It's almost like when you're doing your eyebrows. You want almost the curve to come in from the inside of the eye and going up to the eyebrow. Same with the up here in the scalp area. You want it to kind of curve into the cheek so it looks continuous, so it doesn't look fake. And then the same thing with the jawline. You want a little bit of thickness in front of the ear to your jawline. Not thick, meaning abnormal, but just something that is actually substantial to hold your lower face up.
Right.
The other thing is when I see people with facelifts, that's the other big area because, there's a lifting of the tissue and ears are moving in different places and there's a lot of tightening in front of the ear. A lot of times you see a face that looks pretty normal in the front, but from the side view, they're really concave there. You have to put something there because it looks facelifted. So you want to put a little volume there and you want to make that curve because they almost always lose that curve. And you normally see it like a year after a facelift when all the swelling comes down and everything kind of settles. All of a sudden you see that lack of shape there. And then you start seeing things, you almost see like the cheek is progressing into the neck without a barrier or without a mark, without a line or something that's breaking the vision. And you need a break in the vision to maintain that youthful look, because the brain says, oh, if I see that line there, that person's young. It's again, it's optical illusions, but they are something that when you look at yourself in the mirror and you see this, you're like, oh my gosh, it feels good. It's like a good hair day. It's like, oh, or I
good
got my
face day.
skinny jeans and they actually fit. That's how you feel, and that's really the goal, is to have that feeling when you see yourself or when people see you and they respond.
So you're doing all sorts of interesting things with fillers, not just the basic stuff.
Probably none of the basics. Okay. So I definitely like doing lips, but it's only when they need it. Everything has to be proportional. I think that's the real beginning, is you got to make sure things are proportional. And I think a lot of people don't even realize that as they are neophytes into filling, and there's a lot of new people into it. And people, I've have 24 years now of experience doing this. I was there when we started with collagen back in the day, and you learn what works, what doesn't work. But definitely proportion is the number one thing you got to keep in mind. If somebody has a nose job and their nose is way too small for their face, they don't even realize it until you start looking at them. All of a sudden, you're like, oh, we filled the nose a little. Good. And all of a sudden, their face looks gorgeous. You're like, see.
So you can fill
the
nose. Oh,
yeah.
Okay.
We definitely do a lot of noses. Like everybody in South Florida has had a nose job. That's just normal. It's kind of like boob job, nose job. That's what you get at 16 or 18, whatever. But it's... and surgery is always going to have a great endpoint, that it's a bigger endpoint than these other things, but sometimes you're stuck with things that you may not be happy with, and we can adjust them just slightly. And that's usually what I'm doing more than anything, is just slight adjustments, just very little things that make a big difference at the end of the day. And people don't recognize it, but putting a nose into proportion with the lips, or making the upper lip look smaller just by illusions, by making maybe, it's called a philtrum, a little bit longer here, or popping out the nose a little bit. These are the things that you can adjust, and all of a sudden it's like, oh, this looks much better. Yeah, so it's making sure everything's in proportion, making sure that the shapes are the way they should be, going and making sure the skin tone is good. And that's the next step, is making sure that if you're getting a lot of sun, which I think people are like at least a little bit better on board with using
Everybody's
skincare.
careful here, but in South Florida, it's so hard. Just walking to your car in the parking
Oh my gosh,
lot.
I know. And everybody plays tennis and golf.
And you know what I don't like? You have anything for when you get these spots
Oh
from
my
the
gosh,
sun?
yeah, absolutely.
What do you do for that?
Those are so easy.
Laser?
Yeah. Again, I think we've got a pretty good handle, face and sort of neck. It's really as we work down the body, which hands, we fill them. I mean, Restylane Lift just got FDA approval for filler of the hands.
Oh, for hands, okay.
And I will tell you, it's not just the filling of the hands that makes a difference, because when you fill it, you're not seeing all the tendons, you're not seeing all the veins, which most people end up seeing. You end up seeing like a softness to the texture, because all that hyaluronic acid under the tissue holds water, and this tissue actually looks softer.
Okay.
So you end up having like a more soft and supple hand, which, if you didn't have it before, all of a sudden you're like, oh, this is nice.
Yeah.
But you could do laser.
A lot of tweaking.
Oh, it is. And, you could spend a year in my office and I could do something every day different to you. But, you can do a laser, just a regular IPL for the brown spots. That's nice. One of the other things we started doing, too, that is kind of interesting, again, I have to go back to I've fallen apart, so I need to keep things together.
That's why I like you.
I know.
You're watching out for us.
I am.
By watching out for yourself.
By me, exactly. Be glad I'm very self-centered, right?
Nothing wrong with that.
I know. So I started doing IV therapy, and IV therapy is very interesting. Yeah.
For what?
Well, okay, it sounds crazy. I went to Coachella and I was like, oh my gosh, they need IV therapy here because these people are just getting wiped out, you know.
Good idea.
It would be awesome, but I'm like, that's too big of a project. I'm not doing that.
Going to Coachella.
So, in my, right, I'm not worried about their IV therapy. I'm worried about my IV therapy. So I started investigating IV therapy, and it's, you know, it's adding vitamins, amino acids, glutathione. Glutathione actually is fantastic for lightening the skin. And
really?
Yes. And when you have people doing their IV therapy on a regular basis, and usually you have to do it like a week apart or 2 weeks apart, you can do probably about 6 of them, and the skin looks so much better.
You're kidding.
It's funny.
I've never even heard of this.
Yeah. So I do see the younger people don't seem to do as well. As you get older, and I think you're more depleted of these things, you know, because when you look at a vitamin bottle and they say RDA, that's just the minimal amount of vitamin you need to not show disease. Okay, so you're already like at bottom of the barrel on that one. I think when you get older, you're getting to the bottom of the barrel of everything. Yeah. So, you know, your hormones are bottom of the barrel, your vitamins, your amino acids, whatever. But I think people respond better as they get older. They need these things in their body because, you know, to not catch a cold, you know, your immune system booster, things like that. But the glutathione seems to be helping people look more brilliant with their skin.
Really?
Yeah, so that one's pretty cool.
So it's you do an
Just
IV
for half an hour, 45 minutes.
Like every couple weeks?
Yep. Yeah.
And your skin will look better.
And your skin looks like fresher.
Wow.
Yeah, it's pretty cool. And you know what? You feel better.
You feel better.
Which is even better.
Yeah.
Yeah. It's interesting because I probably do one about every 2 weeks now. And it's just like, oh, the day you do it, it's like I feel normal. But the next day you're like, wow, what happened to me? You know, I'm like ready to go run a marathon. Yeah.
Okay, that's intriguing.
It is.
I like that.
You know what? It's just another modality of how do I kind of squash the aging process as much as I can. You know, if I can make myself any healthier, any ability to live to 150, you know, that's kind of my goal, which may be unrealistic. But
good luck with that.
Yeah, I want to do it and like be normal and be intact when I get there.
But you know, people, especially in South Florida, look much younger than
oh my God, so much better
people
here.
Anywhere else.
I personally, I think South Florida has the best looking people. I mean, you go to Publix and the people that are checking you out look better than anybody you see anywhere else. It's just like, wow, you must be going somewhere because you look great. You know, it really is interesting. And of course, California, people think they all have the best looking people or the best doctors. We think we have the best, you know, I guess it's probably regional, but I really do think that the people down here are much more in tune with looks because it is a version of, I want to say, it's kind of a version of money down here. You know, it's kind of like if you look good, it's kind of like equivalent to having
it's an asset.
Right. It's an influence or something. It is an asset. I think that's the best way of saying it.
And you know, any of these procedures are a sign of affluence for people.
Yeah,
it's almost like a status symbol.
Yes. And I think that's where the lips kind of came in too. You know?
Yeah?
Yeah, I think, see, I can afford to do my lips. That's why they're huge.
Yeah,
and everybody knows. Right, exactly. And I got my Louis Vuitton, you know. So I think, you know, that is. And for a while, I think even being bruised was a little bit of the affluence.
Showing off your bruises.
Yeah, exactly. People did not mind having bruises. I personally think if you bruise, you lose, and I definitely do not want anybody bruising out of my
you don't
office.
bruise people.
No.
You didn't bruise me.
No, you don't, because when you use cannulas, and I am a huge cannula user, and not everybody likes using cannulas, I use them because it really reduces the bruising.
Now, explain what a cannula is.
Okay, so cannulas are, it looks like a needle to the rest of the world. So if you're thinking of, oh, I'm going to get a filler, you're thinking, oh, I'm going to get a needle in my face. You're not. A cannula, I do make a little opening with a needle, but then I put the cannula, which has a blunt tip on it. So when I put it in, it's just kind of bouncing through the tissue underneath, and it's not cutting things up and causing.
So that's why it doesn't bruise. Okay.
And it doesn't hurt, really. You know, it's weird because you're kind of tunneling around a little bit. You know, I think I'm very comfortable with cannulas, one, because I've used them forever now with fillers, but also because when I used to do liposuction, we used a lot of cannulas, and so you kind of learn how to use cannulas. So a lot of
you don't
doctors,
do liposuction anymore.
No, because I have a cool sculpting. I wouldn't touch it. Yeah, you know, I can get such great results with cool sculpting and have zero downtime and have zero side effects that to me it's not worth it. You know, it's a lot of trauma to people. And there are people that do fantastic jobs out there. But I just think it's so traumatic. And because I did it, I saw what was going on
You watch
there.
what really happens.
Yeah, it's like,
Okay.
I think this is much nicer just to do this in a real simple way. And we'll just kind of, honestly, it costs about the same amount of money at the end of the day, but it looks fantastic because
Okay.
it's very, like every time you kind of know exactly what you're going to get with the machines. Versus with people, you don't always know what you're going to get at the end of the day. You know, God forbid somebody's having a bad day, your surgeon, and something doesn't go the way they want it. So it's not invasive either. And that's my whole goal of all this stuff is the least invasive
Right.
as possible, the least downtime, the least out of commission. You know, people have lives out there that we respect and we don't want to really interrupt their life in any way. We just want them feeling good. So we have a lot of fun.
Yes, I had fun in your office yesterday.
It is
You're like,
fun.
I can do this,
I know.
this, and this.
It's like it's like it is like a candy store
Yeah.
there. You know, there it's just everything is just.
And you can look at somebody's face and tell them what would be the best combination of things.
You know,
not just one
I
thing.
do think that comes with a lot of time of doing it.
Right.
You know, I think, and I was actually talking to, I don't remember who it was yesterday. That's another side effect of aging is you don't remember anything. But as long as I
Gotta
can
work
look
on
like it
that.
right now. Exactly. So, yeah, you know, I think one of the hardest things is actually understanding what's wrong with somebody, you know, because I think it's more diagnosing the problem and not addressing exactly the symptom. So when somebody comes in and said, "Ooh, I hate this line," and they're pointing to their nasolabial line that everybody has filled with Juvederm for 100 years because that's what we were told on the commercial. You know, it's not that. It's actually lifting further out, like we talked about.
Yeah.
Sculpture in the scalp,
that would pull that
volume in the cheek, radius in the jawline, threads to lift. That pulls it out so much that it's rare that we'll put it
You don't
in the
even need that anymore.
nasolabial. You
Wow.
don't. You don't need it. And on top of it, when you look at most people that have been doing it for years, they end up looking overfilled and their eyes start getting smaller because all that filler just keeps moving up.
Wow.
It stays for years and years, and it just moves up the cheek, and it starts to end up like very thick around the nose area.
Oh, wow.
So people look very puffy in the front of their face, and that, like, I do have to dissolve a lot of people. You know, in the past, I've even had to dissolve some on my own because it's part of the learning curve. But it's just, you know, it took years to figure that out. And
So you can dissolve it with a solution?
Hyaluronic acid is dissolvable with hyaluronidase, which is an enzyme that just breaks it down. I actually use it a fair amount because, you know, I might be filling somebody and we have something that just doesn't look quite right. We just erase it. It's almost like a little magic eraser. It's like, oh,
Wow.
no, that's not right. Let's just take that out.
Okay.
And it just kind of thins it out a little bit and dissolves it and makes it smoother. You know, you can obviously overdo it if you don't know what you're
Yeah.
doing, and you can make a sinkhole in somebody.
Right.
So it's not something, all this stuff has its goods and its bads, and it's a matter of somebody being very familiar with what
Yeah.
they're using and the tools that they're using and the right tool for the right place. So it's like trying to figure out what the problems are and how are you going to address
you
it
fix it?
to get the best result, the most economical way, the best long-lasting results. And some of them are more long-lasting than others. You know, like a real simple one. Somebody comes in, they feel like they have tired eyes, and maybe they have a little hollow under the eye. When you look at them, a lot of times it turns...
That's a big area that people ask about.
Big area.
Under the eyes.
A lot of times it turns out I actually fill the eyebrow first. Because what happens is we flatten, again, everything flattens out. We go from a 3D person to like a 2D to 1D person over time. We just kind of start flattening out. And so if you fill the eyebrow, all of a sudden it lifts the eye and opens the eye, and it changes the whole structure. And all of a sudden somebody's eye just totally opens, and you're like, wow. Then you put less on the underside because you don't want too much there, because then you
Right.
look pillowy over time.
Can you even put filler in this little area? Because I've heard that it's...
Yeah.
Okay, because I know a lot of
Yeah.
people that want that.
Yeah,
And
yeah. So under the eye, above the orbital bone, which is that ridge right over your cheek, you can, if you're using cannulas, I would not personally use a needle there, but you can use a cannula and you don't bruise anybody or anything. You can just put a little drop of it in there. And usually under the eyes, I'll probably correct maybe 75 to 80% of it,
Wow.
because it does swell a little afterwards. You kind of want to be careful with
Yeah.
that. But when you do the upper eyebrow too, and you make the shape, it's just beautiful. You can touch it off with a little Botox. I sound like I'm making a recipe for something.
No, but that's how you work.
Yeah, it is.
Because that's what you were doing yesterday.
Right.
Me, you were just a little bit of this, a little bit of that, just like
right, you
little
just
combination.
you just work it, and you're making sure that everything is in its right place. But you can change the whole appearance with such a small amount.
Yeah, it is a very small amount. I had another doctor in here, Dr. Steve Fagan, you probably know.
Yeah.
And he was explaining to me how it's such a small amount of filler.
It is.
People think you're putting a huge amount in their face, but it's really just
right. It's like
a
a
drop.
teaspoon,
Yeah.
1 ml. Put it in a dropper and see how much 1 ml is. Like pull up one of your kids' dropper things.
Those syringes are deceiving. They
They
look
like a lot more. But you have to remember, like a hyaluronic acid, as much as you have 1 ml there, you have to be respectful. That 1 ml will pull 1,000 times its weight of water.
Oh, okay.
So you're putting an ml in, and if you're overcorrecting or fully correcting, you have to always realize that in a month they still may swell. You go out and you have a binge night, a crazy night. You drink a lot. You're swelling. You're retaining all the fluid. And you look like a puffer fish,
Oh, okay.
So you have to be respectful of what you're putting in somebody, a little bit their lifestyle, and kind of like know the patient. Some people retain water more than others, and you have to be a little bit lighter handed on them. Some products don't pull any water, like the Radius doesn't pull any water. Sculptra doesn't pull any water. So you kind of, and each hyaluronic acid has different properties too. Like Voluma, it's a very lifting and firm product, but it also has a lot of flexibility to it. So it's a great one for mid-face. When you think about where you're putting your fillers, it's like something firmer can go on the outer aspect of the face because you're not having a lot of motion when you're going to the central face, which is the mouth or the eyes.
Right, because when people move and talk,
yeah,
you're strange. You see those people.
Yeah,
they look okay when they're not talking.
Exactly,
or when they're not smiling, and then they smile and everything's
right. You're like, what happened? You're like frightened when you see them. It is, and it's also like when they're trying to speak and they can't because it's so heavy that they're like, it's kind of like a blah blah blah. So it is. It's really that. It's seeing and knowing your different products.
Well, you know what? You have so much experience. After talking to you, I would never go to somebody that's new to this business because I'm sure there's a huge learning curve.
There's a huge one.
And it probably takes years.
I already went through it.
And it takes years to get to your point to know exactly what somebody needs and what works together.
Right. When you're doing it all day long every day, it's just like, wow, wow, you know what a neophyte you were before, but that's less life,
Yeah, but I'm just saying, if you pick your doctor, pick one with experience.
You think, I know, a lot of people like to shop the price, and they're like, well, this person is brand new.
But that's another thing about price. I mean, you can go to somebody that has a low price, but you're not going to get the quality, so you've wasted your money anyway.
Right? It's
how it's done.
The injection. And on top of it's funny because I haven't changed my prices. Actually, I don't think even ever. And what I find, if anything, I've lowered them. But it's really when you're putting more global, meaning whole face endpoint together, it's more expensive. And people think it's a bigger price. It's not. You're just treating the whole face instead of. If you just do lips, everybody's at the same price for one syringe of Juvederm. They're all going to be the same because you have to make a living off that.
Right.
So it's going to be the same. But if you do lips, you do cheeks, you do jawline, you do scalp, you do threads, you're adding all these things together
Combining
to get an
all the different
endpoint.
things.
Yeah, it definitely. But you might not go to surgery so quickly too, and that would be the alternative. Is you're holding off things that are more expensive down the road too. It's lots of fun.
But it's certainly an investment. I mean,
it is. It is. I know. It's a big.
I think
investment.
we're all kind of selfish here in South Florida when it comes to that sort of thing.
It's like, how do you give that up? People do have Allenby funds. I know they do.
Secret funds, I'm sure.
Yeah, husbands come and meet me because they're like,
"Oh, you probably know all about that."
Yeah,
all my girlfriends are like, you can't go home and tell your husband that you just spent this money on your face. They don't understand.
I was thinking about even like changing so when you get charged, it doesn't say Allenby Cosmetic Dermatology. It says
because
something
that all
else.
comes on the statement.
Right. Golf. If you said like golf pro. They're like, she's taking golf lessons. Yeah, I was like, no.
I don't know. You're right because that's the big fear of women because men don't understand. They don't.
They have no idea.
Yeah.
Most men think you're spending $400, and that's about it.
And they like the way you look.
Oh, they love it,
but they don't want to know how much it costs.
And they're very comfortable with, I had laser. They don't want to hear Botox. They're frightened of that. They don't want to see lips that are crazy. They want to see.
Crazy lips. Men don't like that.
No, they really.
Yeah. That's more of a women must do that to show other women because
it's another woman thing. Yeah.
Yeah.
It's
I don't think any men.
I don't either. I mean, I don't even know any women that really like it, but they're like very competitive with these things.
But you're seeing less and less of that now. I know.
Oh, I don't. I mean, honestly, my patients, I don't see it at all. If anything, they're like, don't do my lips. I'm like, we have to do something here. You have no lips. We got to do something. So, it's like part of the proportion thing. If you have no lips, it's just you're not completing this package.
So you can make it look natural.
Oh, gosh, yeah.
Okay, we got a couple minutes here. Ooh. Why don't you give your location?
I'm 6290 Linton Boulevard. I'm in the Addison, which is right next door to American Heritage. Oh, I love the building.
Yeah, right by American Heritage School.
Right. Obviously, I love it. I'm building out in the same location. So it is a fantastic place. My phone number is 561-499-0299. Allenby Cosmetic Dermatology. Just Google us. I'm usually, if it's Allenby, it's going to be at the top of the list. Yeah. But dermatology in Delray Beach, we've been there for 14 years now. So we'll be there.
And the big event is
November 9th.
November 9th.
We're so excited.
Teresa Judice.
Yes.
And if someone wants to go to that, do they need to sign up? Or
they should call. We actually already have about 150 people who are coming at this point, and we expect probably more. So there is a point where
I think you're going to have a lot more.
I think we are too. And honestly, this is going to be
some of these
so much fun.
And people love them. Yeah. And they come out to meet them.
Oh, we're so excited. We are. Yeah. We're like just tickle pink.
It's gonna be fun.
She's gorgeous and she's fun sounding.
You see, she's all built now. She did the whole workout stuff. She's like a bodybuilder.
Honestly, she looks beautiful. We are doing signed photographs with her, and we have photo booths.
And she's available for selfies with people.
Yeah, and we have all the things to take pictures.
Okay, so that's November 9th at Allenby Dermatology, starting at 5:30.
Yep.
Okay.
Yep.
All right. Hopefully we'll see you there.
Oh, I hope so.
Okay. Bye-bye. See you next week. You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.